I grew up in a remote seaside town like Port McNeill. The town I came from was only 400 people. So when people said, "You're going to a remote seaside town," I'm like, "Oh yeah, how many people do they have?" I think it was 3,000 at the time. I said, 3,000, that's a big place, that's excellent. So I think people who grow up in remote areas, in rural areas, tend to do better if they work and live in remote and rural areas.
So Port McNeill is kind of a smaller place. It's pretty north-facing. It's kind of at the entrance to like the Pacific Ocean.
Most people make it to Campbell River and don't choose to come further north, and they're missing out on the wilderness and the diversity of the wilderness, the beaches, ecotourism, and all of the things that are involved around this area.
But you have to understand that it's different, and you have to be okay with that. And I think so long as people, and particularly people who they come, I always assert that rural works for physicians, providers, if there's two things satisfied. One is that you can't be alone, you have to be with somebody. And two, that you have to get out of town every so often to come back and appreciate how wonderful it is to live and work here.
I feel like there really kind of is something for everybody. I think you'd really thrive if you had a bit of a, energy for outdoor activities, and even just, that could be something as intense as going for a big hike, a big mountain bike ride, gravel bike ride, going for a paddle out in the ocean. But it could be just something as easy as sipping a coffee and looking at the view.
And there's nothing outdoors that we can't do here, whether it's motorbiking, ATVing, paddleboarding, beachcombing, beach hiking, or wilderness hiking in general. All the things that we love are really accessible. No questions. We're not driving long times to get to those things. They're right there.
Starting out my career in family medicine, I had opportunities to work in family medicine clinics in a big city, and to juxtapose that with here, your scope of practice would be quite narrow. You would be referring a lot of things. You probably wouldn't even be doing much procedures and stuff yourself in clinic, and that would be things like biopsies and injections and stuff like that, because there's so many specialists around. And up here, I'm doing a lot of my own procedures and stuff like that. And also too, I get to be exposed to working in the emergency department. So being up here, you kind of get, an excuse to go in there and just dive into the deep end a bit.
People are looking for that excitement and that draw of city living, and they don't realize that all that happens in a small community too.
The commute to different areas, so we're driving, we're ferrying, we're flying through the helicopter, with the helicopter, it breaks it up, it makes it more varied, it makes it more enjoyable. But the relationship that you have with communities, particularly remote communities, is so important, and it's so key to longitudinal care. When you see those same people in the emergency room, or when you take a call from them when they're in distress or in trouble, it makes a difference when you know folks, or when you have a relationship with them. And it's very rewarding work in the sense that you get to do truly frontier medicine or truly remote work, and I find that particularly enjoyable.
We absolutely support each other, that we're a slower station but a fun station, that we support everybody, that there is work for one, because that's always a bit of a concern when people move somewhere, is there actually work for them, and that you're moving into a community that you're valued.
There's opportunities absolutely, from x-ray techs to lab and nurses, care aides, community health workers. There's an opportunity for anybody. I think, and even if you want to do something with a diploma-based level of education, there's lots of opportunity for that. So absolutely, it's the land of opportunity for healthcare workers.